And now I'd like to turn the program over to our moderator, Jackie Curley.
Okay. Well, good morning, everybody. As you heard, my name is Jackie Curley, and it is my privilege to introduce each of these three remarkable young women who will speak about their projects. Our chapters of the AAUW have maintained the annual tradition of inviting 2 or 3 AAUW fellows who live and work in this area and who agree to share their work with us. The program is always interesting, and I believe it makes us feel proud that our organization provides this support. After each of these presentations, we will have a little time to interact with the fellows one at a time. So, the first of these fellows is Monisola Jayeoba. She is a fourth-year PhD student in the Technology and Social Behavior program at Northwestern University and a 2024-2025 AAUW International Doctoral Fellow. Monisola currently works in the Personalized and Adaptive Technology for Health Lab. She leads user research and co-design efforts with healthcare professionals and patients. Her research explores how human-centered design and artificial intelligence can work together to create transparent, equitable, and trustworthy health technologies. Through her work, Monisola aims to bridge research and real-world impact by designing digital tools that empower clinicians and improve patient care. Her presentation title is Low Burden Electronic Health Record Strategies for Engaging Oncologists in Digital Health Behavior Change Interventions, a qualitative interview study. So now here is Monisola.
Thank you so much, Jackie, for the introduction, and everyone for joining this call today. As Jackie has introduced, my name is Monisola Jayeoba. I am from Nigeria, and specifically from the southwestern part, so I am proudly Yoruba by tribe. Before commencing my PhD at Northwestern University, I earned my undergraduate degree in computer engineering, and thereafter I worked for 2 years as a user experience researcher in a leading digital health company in Nigeria. And then with a full ride MasterCard Foundation scholarship, I proceeded to the University of Edinburgh, Scotland, where I earned my master's degree in design informatics. I am excited to be with you all today and present my research on low burden electronic health record strategies for engaging oncologists in digital health behavior change interventions. I must note that this research was done during my fellowship year, and so I would like to give a very brief appreciation and say big thanks to AAUW for the award, which was very germane and to the success of this research during my fellowship year. On this project, I collaborated with other expert researchers across 4 relevant subject domains at Northwestern University, and I am very grateful for their contributions to this study, because this study is part of a bigger study and ongoing clinical trial at Northwestern University Hospital. Now to my study. I'll start by sharing with you the motivation for this study and the problem statement. Health behavior change is critical for many cancer survivors, as an estimated 71.1% of survivors who have completed primary cancer treatment engage in at least one prevalent health risk behavior, that is one of smoking, insufficient physical activity, and poor diet. These risk behaviors increase survivors' susceptibility to cardiovascular diseases, cancer recurrence, second cancer, reduced quality of life, and increased healthcare costs. And so it is imperative to address them. To support health behavior change, digital health behavior change interventions, which includes technologically assisted behavioral treatments for modifying health risk behaviors, are becoming increasingly available to patients to promote healthier lifestyles. A prominent example is the first of its kind scalable telehealth cancer care trial led by Professor Bonnie Spring at Northwestern University. And this particular study is the bigger study that my study, which I am talking about today, is a part of. Research studies in the past have treated these risk behaviors individually. That is, there have been several interventions targeted at smoking cessation or like physical activity or nutrition, or even in pairs. However, working with an estimated 3,000 participants across 11 Northwestern Memorial Hospitals, this novel telehealth strategy aims to treat all three risk behaviors at once. Although digital health behavior change interventions have been shown to be helpful in facilitating behavior change for cancer survivors, long-term adherence to these interventions remains low, and patients are not able to fully receive the benefit of staying true to their treatments. Amongst other reasons, something we felt was missing was oncologists' involvement in supporting their patients throughout patient enrollment and participation in these behavior change interventions. We cannot completely hold oncologists responsible for not getting fully involved because these behavior change interventions are often done as standalone community programs, research initiatives, and sometimes independent clinical trials outside the oncology care. Consequently, oncologists are often unaware of the existence of these interventions. They don't even know that these programs are happening, right? Making it difficult for them, the oncologists, to refer patients to these interventions. So this lack of integration also means oncologists are unable to provide ongoing support and reinforcement, which is critical for maintaining long-term adherence to this treatment. As a result, patients may not receive the necessary guidance and encouragement from their trusted oncology providers, further contributing to the low adherence rates observed in digital health programs. Solving this challenge led to my study. As more studies aim to increase the implementation of digital health behavior change interventions, questions remain regarding I'm just going to take this away in case it's... Oh, okay, I have a quick question, Jackie. Do you see the...
Yes.
Do you see the control, the Zoom control? No, is
you're not
the slide showing?
a light showing.
Or is
It's
just,
blinking. Is that it?
okay. Is it clearer now?
It is blinking now, yes, if that's what you're asking.
Okay, cool. All right. Thanks.
Okay.
So questions remain regarding how these interventions should involve clinicians to improve real-world patients' adherence to these interventions. But before answering the how, it is important to understand the why. So why involve clinicians? Specifically, why involve oncologists in digital health behavior change for cancer survivors? Prior research has consistently shown that clinician-patient communication is central to promoting health behavior change and increasing uptake and adherence to the digital behavior change interventions. When clinicians, specifically for this study, oncologists, refer patients to behavior change interventions, they provide crucial supportive accountability, and that can increase patient self-efficacy towards adopting healthier lifestyles. Other studies have suggested that when clinicians actively motivate and support patients' involvement in health behavior change interventions, it can enhance their understanding of and trust in the intervention, potentially leading to long-term adherence. Hence, the aim of this qualitative study is to identify oncologists' preferences for strategies to facilitate oncologist-patient communication about risk behavior and behavior change, with a specific focus on conversations about digital health behavior change interventions. Additionally, the study also explored oncologists' needs and support requirements to facilitate these conversations. So we want to know how might we help oncologists to better support their patients, essentially. What do they need? What support do they need? Our findings provide recommendations for developing low-burden strategies that can be seamlessly adopted and sustained in practice. To that end, our study asked and answered two research questions. How do oncologists want to engage patients about health risk behavior change, with a specific focus on conversations about digital health behavior change interventions? Secondly, we asked, what are oncologists' support requirements and needs to facilitate these conversations? Now to the method. Now that I have established the motivation and aim of this study, I will proceed very quickly to talk about the method, how we recruited oncologists, collected data from them, and analyzed the data. This study took place in a National Cancer Institute designated comprehensive cancer center situated within Northwestern Healthcare Network. Our study participants were oncologists, that is clinicians who provide cancer and cancer survivorship care within the cancer center. We conducted one-on-one semi-structured interviews with 18 of them, recruited across 11 clinics in the Chicago metropolitan area. But before anything at all, we obtained ethics approval from our university's institutional review board, and all participants gave oral consent to contribute to the study. 3 researchers from the team led one-on-one, including myself, led one-on-one semi-structured interview by Zoom with video communication enabled to help us get like cues and like body language and all those things that we typically might miss in video, in just audio interviews. Each interview session lasted approximately 1 hour duration. All the 18 interview sessions were recorded, and the transcripts were also generated by Zoom. So this transcript forms the basis for the data that I analyzed for this study, and I will be sharing with you subsequently. Study participants were each compensated with a token of $50 gift card. I led the data analysis for this study, following Brown and Clark's 6 steps for performing thematic analysis. Before commencing the analysis, first I immersed myself in the data to gain an in-depth understanding and develop deeper empathy. I did this by listening to the recordings, observing the cues, and checking for data completeness and consistency between the recordings and the transcript. Next, I performed the preliminary analysis or open coding using Microsoft Word and concurrently with collecting newer data from newer participants, during which I identified emerging themes. After that, I did a second round of coding using MassQDA and all. I wouldn't want to bore you a whole lot about this, but it was more about listening to the participants, listening to what they said. And so I did my analysis at semantic level, focusing directly on what participants said and how they felt. The team collectively stopped collecting new data when we reached data saturation and no longer found new themes. Now to our findings. This was a very interesting research, and I had elaborate findings to report as you will find in the published paper. However, for this presentation, I will highlight the findings that stood out the most and to me and those that address the research objectives. We know from literature that clinician-patient communication is relevant for patients' long-term adherence to health behavior change. Nonetheless, it was interesting to hear and watch the oncologists embrace some pivotal roles in promoting health behavior change to their patients. Collectively, the clinicians demonstrated that they weren't only interested in talking to patients about risk behavior, but they were keenly motivated to take actions towards caring for their patients. Hence, I identified two action-oriented communication pathways. It wasn't just about talking, like I said, it was also about what they were going to do about it. Two action communication pathways through which oncologists would love to promote health behavior change among cancer survivors. First, the oncologists reported interest in referring patients to relevant digital health behavior change interventions. Secondly, when their patients enroll, they want to reinforce patients' behavioral goals over time. And I will touch on these findings very quickly. So like I said, all 17 of the 18 participants said they would be very happy and excited to refer. One of them did not respond to the question. So very briefly, I'll read out like one participant code. Participant 7 said, I would definitely highly recommend programs like this. That is interventions. It's just so important to be able to try to get patients to, improve those high risk factors. So they did show interest. Also, they demonstrated interest in not just preferring, but also providing ongoing support when patients do enroll. Like P3 said, oh, we could chime in and say, hey, I love that you are participating in this study. Just want to reinforce. I think it's a great idea. Although they were very motivated to refer and provide ongoing support, oncologists, consistent with what we know from literature, oncologists raised concerns about the common barriers which limit their abilities to perform these actions. For example, like discussing the limited time they spend with patients during their infrequent appointments and lack of expert knowledge on behavior change techniques. Participant 5 said, I think I completely agree with the lack of time that we have to talk about this with patients because we often have just like 20 minutes of slot. I don't think I have personally enough training or knowledge to give them specific recommendations on what they should do. And I can tell they want to know. So I think it's a lack of time in clinic and a lack of probably knowledge on my hands on how to counsel them. So they are motivated to be a part of these interventions to support their patients, but they also have constraints. And so transitioning to my second team, we identified the support requirements or needs that oncologists require to better foster their participation so they could promote health behavior change to their patients. Broadly speaking, they discuss their information needs and also like the needs for some technology support. Because of time today, I will give a very brief overview of the information needs without reading out the codes and focus very more on the technology support. So to the information needs, oncologists wanted to receive like all the details they could about interventions, like who is in charge, what would the treatment entail, what patients are eligible, and things like that, the timeline. And also when patients will enroll, they indicated interest in receiving enrollment information and notification so they know to follow up with their patients. Now to the technology support. This was like my highest moment as an HCI researcher working on this project. I was really elected to be able to identify this technology support for the oncologists. They indicated interest in receiving overlapping and parallel systems through which they could, one, seamlessly message patients to introduce these interventions to them. They said something like, what if we don't have time during the patient visit? We want a means to be able to reach out to patients electronically via the electronic health record systems. In addition to that, they also requested for complementary print materials like hand flyers or like posters that they could easily give to patients during patient visits. As mentioned earlier, our participants reported that they're often unsuccessful at discussing risk behaviors due to lack of awareness of these relevant programs and generally forgetting that these programs even exist at all. Also, they have difficulty identifying patients who are eligible for these interventions and matching them to suitable interventions. So to address this challenge, oncologists expressed interest in recommender system that serves parallel tasks as also a reminder system. The clinicians wanted a recommender system to identify and decide, like support their decision making, whether a patient was eligible and suitable for relevant intervention studies. They also wanted the reminder system to provide them with just-in-time nudges prior to patient's appointment so they know to discuss possible interventions with patients. Lastly, on the technological support, all the oncologists indicated high interest in receiving patient progress reports when their patients are actively participating in behavior change interventions. They further discussed how they would prefer to the intervention team designed and deliver these reports. Mostly, the clinicians preferred simple text-based messages sent via electronic record system that has like quick overview, easy to interpret details of patient's participation that could be accessed by the entire care team, not just by the oncologist. So they preferred quick summary in text format over like charts and graphs of like the smoking habits or the physical activity or the workout and things like that. And like giving their emphasis on time constraint and all of that, they wanted it to be very brief, very concise, sent at least 2 days before patient's visit. And that also posed a challenge that we're looking to continuously work on in the future work, which is like aligning the patient's progress report delivery with patient's clinical visit to the oncologist. Because like I said earlier, these programs are typically standalone. And so we do not currently have access to like patients' electronic records to know when next they will be visiting their oncologist. And so these are also some technical challenges that we're looking to address in subsequent studies. So to wrap it up, consistently throughout our findings, oncologists highlighted the needs for this support to be very low burden, to integrate very seamlessly into their existing workflow and not add additional burden of adopting new tools or adopting new tasks to what they currently have, because they do have conflicting like priorities. Additionally, the oncologists highlighted the value of parallel system, like systems that could do 2, 3 things together to make their work easier, like the AI, ML, the machine learning recommender system for patient identification and referral, and the electronic health record messaging system with complementary print materials for referrals and reminders. So based on this perspective, our study put all of these views together, and we put a summary of recommendations of how oncologists want to promote health behavior change with their patients and the support tools they need throughout the entire intervention life cycle. And we put this out to the digital health behavioral change intervention program managers and future designers of digital health behavior change interventions that, hey, before you think of starting these interventions, here are some things you may want to know about involving oncologists. So these are the things you should do before patient recruitment, during patient recruitment, and after or when patients are actively participating in the studies. And to this, I bring my presentation to an end, and I'll welcome questions. But I'll leave this on the screen for you to read through while you ask questions. Thank you.
Mhm.
Can you tell us, are there implementation steps that will follow to use the results of your research?
Thank you. So the results of these are currently being implemented in the ongoing clinical trial that I touched on earlier at the start of this presentation. The clinical trial is currently ongoing at Northwestern Memorial Hospital. And so we are currently designing the electronic record messaging system, integrating that into the current Epic, because we use Epic here at Northwestern, integrating that into Epic, also designing the progress reports, and also integrating those into Epic, so that there is seamless communication between the intervention program managers, who typically are principal investigators, I mentioned for this study, Professor Bonnie Spring, and oncologies and oncology care across teams. So I don't know if that answered your questions, but typically, otherwise, outside of our own study, if there are other intervention programs out there that want to integrate, all they need to know is, if you want to design progress report, these are our recommendations. Design it this way, send it at this timeline, include a recommendation system. But for the first part of this study, we haven't quite completed an implementation yet on our end.
Okay, we have another question. How did you select participants for this study?
Thank you. That's an interesting question. I didn't think there was time to get to it, but I have this slide here, so I could also share. We used about 3 sampling methods. Generally, participants were eligible for the study if they were oncologists and if they were actively providing cancer survivorship care with at least 1 year of cancer survivorship experience. And so we utilized purposive and snowburst sampling. Northwestern University, the Feinberg School of Medicine, has very good relationship with the Memorial Hospital. So we already have contact, and so we just reached out via emails, word of mouth, and so from the first 3, 4, 5 oncologists we reached out to, they also referred us to their colleagues or friends who are also oncologists within the 11 clinics. So we used purposive and snowball sampling.
Prior to your research, was there any way to monitor and hold accountable patients' behavior change in their risky behaviors?
That's a good one. Broadly speaking, I would say in some ways, yes. The intervention program managers and designers send follow-ups to patients. But we saw that there was the missing part, which was the oncologist involvement. And we thought that was also another loose end that, if tightened, could better contribute to patient adherence. So yes, studies in the past have utilized like reminders and various mechanisms to foster motivation for patients, yes. But we saw involving oncologists as another strategy to also like take that up a notch.
Yeah.
We have a question about, have you studied Time Care, a subcontractor to Aetna Medicare Advantage, which seeks to provide support and facilitate communication for cancer survivors? And if you have, what do you think of it?
Is that question in the chat box?
Yes.
Okay. Have I studied?
From Amy Lakin.
Right. I'm trying to go through that.
Time Care.
Okay.
While you're reading that,
It's my first time hearing about that. I haven't, so I
Oh.
cannot really speak to it, but it's something I would look into after this presentation.
right. Okay. Does your study have demographic information about the participants?
Yes, absolutely. Yes, we do have that. And again, those were part of things I thought we probably wouldn't have time to get through. So I just like try to skip those, but yeah. So we recruited 18 oncologists with diverse specializations. Some were like specialized in breast, gastrointestinal, and all. I think 11 out of the 18 were female. Yeah, I didn't put like gender and race and all in this presentation, but they're in the published paper, and I would be glad to send out the link. The paper is publicly available. So I'll just drop the link to the paper in the chat later. But yes, but this is what I have in the presentation right now. But off the top of my head, we had 11 female and I think male. Or like oncologists who identified as male. Yeah.
Okay. Well, thank you. I think if there are more questions, we'll take time at the end. So put them in the chat and we will thank Monisola and go on to our next speaker.
Hi, this is Jackie again. It turns out our next speaker had a medical problem and has canceled. So if we have a couple more questions now, we can do that for Monisola. If not, we can go on to Jaira.
Well, one question I have, as a breast cancer survivor here in Naperville, the Cancer Center has ongoing group sort of chat sessions or workshops for follow-up questions and follow-up sessions as far as things like weight management or diet, nutrition, whatever seems to be the need. And I'm wondering if that kind of follow-up care was available at Northwestern and whether that was mentioned, or is that a strategy that's too time intensive for the oncologists to be involved in?
Thank you so much. That's a good one, and part of what our study aimed to cover. Yes, there are follow-up programs like that at Northwestern Memorial. Um, However, like in the past, we haven't really integrated oncologists into like those kind of programs. And so part of what our clinical trial and the broader study is looking to do is really integrating oncology and oncology care into like post-active cancer treatment, such that as soon as people are done with active or curative cancer care, they can like seamlessly transition them. The oncologist would transition them to like survivorship care. And so that's part of why the oncologist in my study requested for recommendation systems like the one these AI tools to be able to help them like keep track of patients who complete active cancer care treatment and also like match them with eligible interventions. So yes, these programs exist here and there, but there is not one system that has integrated them together.
To manage and track all of the different follow-ups.
Yes.
Okay.
Mhm.
Another question, did participants give you any feedback as to whether this method helped them keep to their goals better?
Thank you. So we do not have a way to measure that yet. We haven't evaluated the impact of this study because this is rather a generative or exploratory study. It's like, oh, we have this problem. How might we solve it? And so like we came up with, oh yeah, based off of this study, these are our recommendations. So in this second phase, which right now we have deployed the clinical trial, we're incorporating all these recommendations into our own clinical trial. And so at the end, we'll be able to evaluate the impact of the things the tools
Mhm.
are incorporated and all these recommendations we implemented. So, but just from this first study alone, we cannot evaluate that yet because it's still very exploratory and generative.
Mhm. Okay.
But we
When
hope
will
we're
when
optimistic.
and when will that end? When will you know?
Um, right now, I am currently transitioning off the project, so I cannot really tell when they'll conclude the clinical trial and all of that. But hopefully, when they do, I might still be a part of it. I'm in my fourth year now, and I have a new project, a different project that I would most likely focus on for my dissertation in my fifth year. So
Mhm.
that's I guess that's the drawback of being a PhD student. Sometimes I just like work on what's like available, sometimes funding wise and things like that. So I may not be able to see this project to the end of it before I graduate, but
No, too
glad to
bad.
be part of it. Yeah. So I sent the link to this paper. The project that I just presented, it's a peer-reviewed paper already. It's been published in one of the topmost journal, like the top journal in medical internet research. It's called the Journal of Medical Internet Research, very high impact journal. I feel so elated to have been able to publish here. So I encourage you all to take a moment to open it or download the paper, go through it. It's I believe it's written in a way that like general audience would be able to comprehend. So hopefully you would enjoy it.
Okay. And this is Jackie again. As also as a breast cancer survivor, I had an unusual situation in which my surgeon wanted to keep in touch. And that was part of his policy. So at first it was very frequent. I mean, really frequent, more less than 3 months. And eventually it went to a year and so on. When I compared my experience with that of other friends who'd gone through something different, I think I was responding better just because of that contact. So you're putting the oncologist as the head of the team in a sense, and having them comment on the progress that the patient has made in certain areas that are threatening to their recovery, I think is a really, really good idea.
Thank you so much, Jackie. Thank you. Yes, we know that the frequency of patient visit decline as patient like progress through cancer survivorship, like they integrate, they go back to their regular life, their jobs, their families, and reintegrating
That's right.
to society. And so like they visit the oncologist less, which is good because like not so many patients want to keep going back to the hospital
Yeah.
because the hospital and the oncologist just bring back those things bring back some kind of like unpleasant memories for some patients. And so even oncologists don't want patients to come back like every month. They want them to go live lives after cancer, which is good, which I like. And so we want to maximize the infrequent visits such that even if it's once in 6 months, that cancer survivors get to see their oncologist. The oncologist would be able to just like chime in on their health behavior, like their lifestyle choices and things like that.
Right. Good. Are we ready for a new introduction?
Elaine, we can't hear you.
I said, are we ready for a new introduction?
Yes, we are.
Okay. Well, as you may have heard me say earlier, one of our fellows had a medical problem and has canceled. So we're going on to somebody else who is on the call. This fellow's name is Jaira Harrington, an assistant professor of Black Studies at the University of Illinois, Chicago. Her teaching and scholarship are inspired by political activism, Black feminism, and global Black diaspora in the Americas. Her current research focuses on the intersection of race, labor, and gender among union-affiliated paid household domestic workers in Brazil. Her title is Violence Invisibility, Black Women's Political Leadership in Brazil. It sounds interesting. So, Jaira, you are on.
Thank you so much for that introduction. Good morning to everyone. My name is Jaira J. Harrington, and I will present to you today Violence and Visibility, Black Women's Political Leadership in Brazil. And so before I begin, just a little bit about myself and my scholarship. So my work is inspired by communities of African descent in the Americas. I have conducted field research on the political activism of domestic workers in Brazil for over a decade. And I've published widely on the intersecting subjects of Black communities, labor, and gender. And I appreciate this opportunity to share my ongoing work with you and the kind of expansive ways that we can think about politics and community representation through it. Here we go. Here is my agenda, which is follows. Contemporary women's representational politics in Latin America, Brazilian women in political leadership, the rise of Black Brazilian women in political leadership. I'll share a literature overview. I'll discuss my methodology. I'll cover some of my preliminary findings, and I'll offer up some final thoughts. So first, let's take a look here at this map, and feel free to participate if you wish. So looking at the status of contemporary women's leadership globally, when it comes to head of state, we have this map here. So you'll see it's from the Pew Research Center, and it's identifying the nations that have had a woman leader in the cumulative years that have been served by women heads of government. So what are some observations that you can make? And feel free to interact in the chat if you'd like, or just share aloud.
I can't see representation from Africa at all. Like there's probably just one country, but yeah, not none.
It's a little empty, sadly, but there are some changes that are being made in the coming year, so we will see. Any other kind of general comments on what is it that we see in this map?
South America has quite a few.
This is true. And this map here doesn't show the October 1, 2024 inauguration of Presidenta Claudia Sheinbaum Pardo in Mexico. So that is another feather in the cap of Latin America. And also the president of Suriname, Jennifer Geerling Simons, was elected this year in 2025. And I also think, though, that the general idea is clear. There really is still quite a long way to go when it comes to electing heads of state and heads of government as women. So women's representation in these fields is still quite limited. Now, as of last year in 2024, there are 29 countries where 30 women serve as heads of state or government. And according to UN Women, at the current rate, gender equality in the highest positions of power will not be reached for another 130 years. So women are still dramatically underrepresented in spaces of political power. So now for my area of research interests, we'll focus on the region of Latin America. So women hold 36% of parliamentary seats in Latin America and the Caribbean. And 10 of 19 Latin American countries have adopted gender parity, which requires an alternation between men and women candidates in legislative elections, a 50-50 representation on candidate lists, and gender balance in public positions. So there are some policy orientations to trying to level out this gender imbalance that we see so widely. Gender parity for elected office has been implemented in Argentina, Bolivia, Colombia, Costa Rica, Ecuador, Honduras, Mexico, Nicaragua, and Panama and Peru. And at subnational legislative levels, there are quotas and parity laws in 11 countries. So Argentina, Bolivia, Brazil, Costa Rica, Dominican Republic, Ecuador, Honduras, Mexico, Nicaragua, Peru, and Uruguay. Guatemala is the only country lacking a quota law for elections. Brazil, which has a 30% quota, weak enforcement, open lists, and the fact that parties can nominate more candidates than the number of available seats, ranks last in the region at 17.5%. Now, in the aftermath of 2020 global protests for racial equity and justice, Black communities globally expressed renewed interest in representational politics. What makes Brazil unique is its historical denial and repression of African influence and Black communities through the ideology of racial democracy. Representation among minoritized elected officials in Brazil has historically been low and speaks to broader trends throughout Latin America. Despite demographic indicators that show non-white people are a regional majority, most Latin American elected officials disproportionately lean toward white men. These gender parity laws mentioned before and the growing culture of racial equity as a standard has resulted in some notable some notable trends for Black women in Latin America. Within this context, there were innumerable firsts for Afro-descendant and Black women, including politicians throughout the Americas, namely Epsi Campbell Barr in Costa Rica. So she became the first Black woman to serve as vice president in any country in the Americas in 2018, and she concluded her term in 2022. The former vice president, Epsi Campbell Barr, was the first to hold this position in all of the Americas. And before rising to the vice presidency, as an economist, she served in parliament. And Francia Marquez is from the country of Colombia. And on August 7th, 2022, she became the first Black woman to be elected vice president of Colombia. And the following year, she was sworn in as Minister of Women and Equality in the cabinet of the Colombian president, Gustavo Petro. Marquez, a noted social activist for Afro-Colombians, feminist, poet, singer, and promoter of climate justice, is from El Cauca, Yolombo, Suarez, the Republic of Colombia's province with the largest population of African ancestry. And in Barbados, we have Sandra Mason, who was elected to be its first woman president in 2021. And not only was she the first woman president, she was the first president of Barbados. This move replaced Great Britain's then monarchical leader, Queen Elizabeth, as the head of state. The decision comes after a joint session of the country's House of Assembly and Senate, which elected her by a convincing 2/3 vote. It was an intentional move toward distancing Barbados from its colonial past and moving toward the direction of an independent republic. Now that we have some regional context, we'll focus on the case of Brazil. So despite accounting for 52% of the population, women represent only 15% of legislators and 11% of ministers in Brazil. Dilma Rousseff was the only woman president in the country's history from 2011 to 2016, when she was displaced by a coup. Brazil ranked 108 out of 155 countries in the World Economic Forum's Global Gender Gap 2021 Political Empowerment Sub-Index, which assesses the presence of women across parliament, ministries, and heads of state. And at the current rate of progress, it would take Brazil over 145 years to achieve gender parity and political empowerment. It is also worth noting that in Brazil, legislators along with NGOs have been lobbying for the approval of affirmative financing measures in favor of women and Afro-descendants. This is in response to the unequal financial support they receive compared to white men and white women during election campaigns. In 2023, they collaborated in opposition to a bill proposing amnesty for political parties. And these actions aim to prevent parties from receiving amnesty when they fail to comply with mandated financing percentages that are required by law. So even when the policies exist, the kind of questions of enforcement, upholding these policies, there still are notable disparities. And despite these shifts, violence against women in politics is a particularly pervasive barrier to political participation. In Brazil, 81% of sitting congresswomen and 75% of women running for mayor in 2020 experienced some version of political violence. And political violence can be extreme for Brazilian women seeking to make political change. When there's also an opportunity for transformation, there's also the peril of violent backlash. So we turn to the story, the tragic story of Rio de Janeiro City Councilwoman Marielle Franco. Now, Marielle Franco, born in 1979 and passed away in 2018, was a queer, Black, proud favelada who spoke about police violence and Black poverty in Rio. And favelas are the kind of shanty towns that you may have seen in scenes or films about Brazil. And she is someone who was a political representative, directly descended from these areas, and spoke out about the kind of oppression that these communities face. She was elected to the Rio de Janeiro City Councilwoman position under the Partido Socialismo e Liberdade, PSOL, Socialism and Liberty Party candidate. And she was tragically martyred in 2018 in a drive-by shooting by former police officers. And her campaign slogan is Eu sou porque nós somos, or I am because we are. And on October 31st, 2024, Ronnie Lessa and Elicio de Queiroz were sentenced to almost 79 years and almost 60 years, respectively, for this drive-by shooting that killed both Franco and her driver, Anderson Gomez. Breaking barriers in this kind of political climate where the representational politics for women and also reproductive justice and these kinds of rights, breaking these barriers, questioning issues of poverty, questioning issues of societal organization, breaking these barriers breaks silence. Although Black people in public office have been celebrated for groundbreaking achievements, Black women's political ascension also exposes the underexplored foundational elements of democracy that include racism, sexism, transphobia, and anti-Blackness through the harassment and violence they experience in their very public roles. So the main goal of this project is to theorize the ways in which Brazilian Black women politicians navigate the current political climate in which they face threats, hostility, and political violence. So I ask, where calls for increased Black visibility and representation in public life are inherently and increasingly violent, how is it that Black women politicians in Brazil navigate this new political landscape? While their individual resilience and success is often the focus of their entry into Brazilian electoral politics, I hypothesize that a grounding in Black community organizations and institutions figures largely into how they push for change in hostile political environments. So a little bit of a literature overview, just to ground us. There's an existing literature on violence against women and representatives in Latin American politics. The scholarly themes include political violence and political femicide. There's also a growing literature on Marielle Franco's life work and activism and her violent death on the political landscape. However, the present literature on violence and sexist threats against Latin American women neither disaggregates nor accounts for Black women officials' experiences. In previous research, the universal category of women centers white women's experiences with sexism and masks the rampant anti-Blackness that Black women face. Also, Brazil is not only the largest democracy in Latin America, but it also has the largest population of people of African descent in the Americas. Black women are a majority group. Following Black feminist research traditions, my study uniquely addresses the misogynoir that is particular to them. And this project also showcases the diversity of Black women in Brazilian politics. Black women politicians in different districts throughout Brazil are represented in the sample. And additionally, the Black women in my sample represent a spectrum of socioeconomic backgrounds and political alignments. My participants will include cis, trans, non-binary, and queer Black women, as gender and sexuality diversity among women representatives is also a significant factor. So now on to my methodology. My primary methodology is qualitative, semi-structured interviews with Black women political officials in Brazil. Participants must have been elected or in their elected position in 2020 at the municipal, state, or federal level. This sample is heterogeneous. There are officials that differ along, that differ along party lines, ideology, age, marital status, gender identity, sexuality, region in Brazil, and time in office. And I selected a qualitative methodology to fully account for the specific experiences of individual officials. I am not seeking a generalizable study, as this research aims to build hypotheses around the problem. So some of my preliminary findings that fortunately this fellowship enabled me to complete include some of the, and so in this presentation, I include some of the interview data that I've had speaking with Black women elected officials. And one of the phrases that really stuck out with me in one of these interviews was "Já passei tudo que você possa imaginar." Então, it said, "I've been through everything you can imagine, from objective racism to subjective racism. There are many cases of racism within political parties, and one representative describes racism as a power relationship. So political parties have power relationships that manifest in explicit speech of racism when they'll interrupt a representative speech. They don't consider their position in leadership, attempt to diminish what it is that they're saying. And when they do not see the potential of a suggested policy or action, the woman official said that there's the use of Black people just to meet a quota or tokenize. And so to speak out about the kind of racism or anti-Blackness that they face, it's silence in the interest of just having someone to represent. And it's also very difficult to maintain those political objectives. So this is the universe of the kinds of experiences that these representatives have within these elected offices. Also within the context of there aren't very many women in these higher official positions, but the kind of tug of war is how does one maintain a kind of safety within these systems alongside the need for this representation to advance the political agendas of marginalized communities. So some of the future directions that I hope to have would include considering transformational politics and political agendas as a critical element to improve the plight of Black communities throughout the region. But there are limits to representational politics, which are quite clear. Transformational change within the systems that perpetuate them, that perpetuate the same kinds of issues and barriers, can only achieve so much. So something that is important to do is to tease out the complications of an oversimplification of identity reductionism with identitarian approaches as a vehicle. So that's just to explain here. In recent years, especially in the US political sphere, so speaking about the kind of grand issues that are going on in the Western Hemisphere, commentators have erroneously referred to the ills of identity politics without citing its origin or clarifying its meaning. Identity politics comes from the Combahee River Collective statement, in that Black radical and queer feminists recognize that one-size-fits-all solutions do not account for the struggles against which marginalized communities fight. Where we find a problem is when an individual Black person becomes the stand-in representative for everyone through reductive logics that collapse all experiences into one person and one representative. And this kind of statement around identity politics with the Combahee River Collective reminds us that Black people are not a monolith. Black women are not a monolith. And the violence that Black women face in politics constitutes state violence and abuse against Black women. These Black women are among those who have the highest access to resources in their respected and esteemed roles. So they have access to security, they have access to decision-making at the highest levels of office in that country. And at the same time, they're left vulnerable and unprotected. Black women who do not have this status, access to resource, access to these kinds of spaces, who are living in poverty, who are poor, who don't have access to jobs, they have a completely different experience that also I think is worth noting. And so these are all the kinds of issues that I think are significant when considering this idea of representational politics, what are its limits, and how we might think about it in comparative context. So I appreciate your time, and thank you so much.
Okay.
We have a comment from Margaret that Brazil has made significant progress since the military dictatorship ended in 1982. She served as a Peace Corps volunteer in Bahia, Brazil, from 73 to 75.
Fantastic. Thank you for that comment. And I also wanted to acknowledge, Elaine said the US is not a leader. Thank you for pointing that out as we were talking about women's representation in higher levels of office. And the military dictatorship of Brazil, which lasted through 1985, was indeed a very difficult moment for representational politics in general. If there was a period of repression that was standard, including disappearances. The elected official that I mentioned, Dilma Rousseff, was a young activist during this period. And the kind of fascinating element of this is someone who had worked so closely with underground student movements to push back against the government, eventually herself was elected to president, but was also removed by a coup. And so if there's something to be said about the kind of historical trajectory of Brazilian politics, what I would argue is that it has largely been uneven. So there are these moments of progress. There are these moments where there is, in progress in different areas. So Dilma Rousseff is a part of the she was the vice president under the first Lula mandate administration. And so she was largely continuing many of the policies that helped to lift millions of Brazilians outside of what was called an economic condition or socioeconomic condition, literally termed misery. And so part of those kinds of social and policy-oriented economic adjustments to society from the federal level help to shift the dynamics of wealth distribution in a country where the wealth gap between those who have and have not is tremendously large. So that's to be said that, yes, there have been these moments of progress, while also shortly after a coup, and then after that, the mandate of Bolsonaro, which further rolled back some of the progress that was made on behalf of Indigenous and Black communities for women and reproductive rights. And so there's this constant push and pull. But yes, it's something to observe all of these kinds of issues come together and with the kind of dialogue of the political sphere, having these sorts of differences come up in a very uneven sort of fashion. Amy, thank you for sharing that. So Amy says, Igualada is an excellent documentary on the rise of Francia Marquez to the vice presidency of of Colombia. Not about Brazil, but I thought I'd mention it. Professor Harrington, this was a really revealing and informative presentation. Thank you so much. I actually haven't seen Igualada, but I have watched a number of the speeches that she's given. And again, the kind of question of the intersections of her identity. She was someone whose political formation was largely through climate justice awareness. So in the community that she lived in, she could observe the kinds of ways that drought and flood and the kind of issues that rural Colombia are experiencing with climate change, or others may define as climate catastrophe. And so with that, she was able to galvanize the rural Black and Indigenous communities to speak out and push Bogota, which would be the center of political and economic power, to consider the different ways that, again, resources and distribution are essential to a political future and the future of Colombia. So she is certainly a fantastic example of this. One question Jacqueline asks, how interested are women in using the vote in Brazil? That's the fascinating thing about Brazil as well, that voting is compulsory. So unlike other kinds of contexts, the kind of interest, it wavers. So yeah, using the vote, it's more like who are candidates. That's kind of like, I think the primary question and concern is. And Elaine, how do you hope your research will be useful? I hope that it will continue to enable broader questioning of what we can expect from representational politics, what are the limitations of representational politics, how it is that terms of inclusion, even through policy change and orientation, may simply not be enough. And I think that this kind of critical awareness will enable us to reach parity, perhaps not within 3 or 4 lifetimes, but perhaps sooner.
Okay.
I'll stop there.
Well, this is just a spoken question from Jackie. I noted in your bio that your current research focuses on the intersection of race, labor, and gender among union-affiliated paid household domestic workers in Brazil. Do you have enough information that you can give us a hint of what you're doing there?
Absolutely. So part of my interest in domestic work in Brazil is an extension of my experience as a field researcher there. So I've spoken Spanish most of my life. I learned Portuguese, and I went there as a graduate student. And my time in researching there, it was very fascinating to me how it is that I lived in neighborhoods that were considered to be the noble, upper class, upper crust kind of neighborhoods where students who were from the United States or Europe or otherwise from the West would be invited to come and research and study and to be housed there. But while living in these neighborhoods, which were very wealthy and predominantly white, with the exception of the women who would come into the households to clean, which would be domestic workers that were hired, or security guards who were overwhelmingly Black men. There really was not much racial diversity in these spaces. And so that was something that was curious to me while living in these spaces. I was often confused to be not the new graduate student who was
Right.
but the
Yeah.
new lady who's coming to clean. And for me, I just saw the kind of ways in which domestic workers in Brazil are a part of the landscape of just the geographies of the various places that I've lived. So I've lived in Sao Paulo, I've lived in Rio, I lived in Brasilia, I lived in Bahia and Salvador. And so with these kinds of experiences, I always saw these women, entering into neighborhoods, leaving at the end of the day. And at first I thought that I would conduct research on what were the political organizing factors of the Black movement there. So as a Black woman in these spaces, I was keenly aware of the kind of racial dynamics that were going on. But I decided to think about what it is that I had seen while I was there. So in 2013, there was a constitutional amendment to finally include domestic workers as eligible for all of the workers' rights that exist for all categories of workers in Brazil. And that was a nearly century-long struggle for that kind of acknowledgement and recognition. So where in 1985, Brazil transitioned to democracy after the military dictatorship, in 1988, there was a new constitution completed, but it did not include the inclusion of domestic workers whose labor is at the intersection of gendered labor taking care of households, taking care of children, race, and the kind of legacies of the transatlantic slave trade in Brazil, and also class, how it is that these women are mostly from lower economic status communities and have generations of families that have worked in these fields. So with that 1988 Constitution, there was not that particular change, but in 2013 that occurred. So putting together a kind of immersive experience that I've had and seeing race, gender, class, all of them interact at once, and thinking through the kind of political promise and possibility of women who are at the most marginal of labor categories, or among the most marginal of labor categories, struggling for representation and finally getting it through the means of constitutional amendment. I wanted to learn more. Why is it there is this interest in continuing to struggle through these means? What are the kind of extra systemic ways that these women are organizing to change narratives around their own category of labor? What kind of social causes are they shifting through their work with one another and trying to make connections among themselves where the state has failed them? And so this was all very fascinating to me. So that is how it is that I've arrived at that. I have a book project that is emergent around this, and the title provisionally is Inscribed and Erased Domestic Workers in Brazil.
Thank you.
I don't see any further questions. If you have questions, put them in the chat. Or if you'd like to open your microphone and ask.
Hello, Kay Madden, can I speak? Kay Madden? No?
Go ahead.
Yeah.
Okay. Jaira, what are your plans after your studies are completed?
This is a part of a larger project where I'm looking at the kind of intricacies of democracy and the kind of spaces where the kind of policy orientation around, for example, with women candidates, the idea is, okay, so let's impose these kind of financial incentives to have more women candidates. This also, by extension of broader conversations in society around Black identity, has ushered in a number of Black women candidates. But in so doing, this kind of push for representation does not fully account for the kind of conditions and circumstances of what the foundations of democracy include, which is sexism, which is racism, so that's the kind of teasing out that I'm doing with this particular section. I'm also interested in everyday people and their experiences with democracy. So as was mentioned before, there's this history of military regime, authoritarian dictatorship, which is not particular or unique to Brazil, but we've seen also in Peru, we've seen it in Chile. And so just thinking about how it is that everyday people are responding to the policy orientations and changes of democracy, the fact that there's more visible representation of diversity and difference, does this make a difference in their kind of everyday lived experience? And where is it that they still see the gaps? So I think that this is a part of a larger project on democracy that is of my interest. And those are the next stages of this work. And so fortunately with this fellowship, I've been able to make some strides in collecting interviews, being able to think more deeply about these questions, having the space and time to do so. And it's been a fabulous ride, and I'm looking forward to the next steps.
Are you focused on more Latin America and South America rather than the challenges right here in the US?
Yes. Actually, that is, I mean, I live here in the US, so it's not like I don't know. But the thing is, I think that what's interesting for the research that I do is, especially when I'm teaching and also making presentations, folks will look outward and have a lot to say critically about um, countries or regions or experiences that may be a bit distant from their own, which gives them the lens to look inward and think about one's experience in the United States and draw some conclusions that they might not have had because of our socialization in the experience of either like growing up in the United States or being socialized in the ways that the U.S. is understood as this paragon of democracy. And I think that it's often useful to have comparative analysis. So yeah, I'm very well aware of what's going on here in the United States. I just also think that it's helpful to consider how it is that politics is not isolated by borders either. The kinds of ways that our global society functions and operates is an extension of broader global systems. So where there are scholars who do focus on the kinds of issues that are going on in the US, I think that with the kind of global interest and the kind of global perspective that we see in our political decision making. I mean, we can talk about tariffs, we can talk about the economy, that the US does not operate in isolation. And for me and my research and kind of like being a person of marginalized experience, I often think about how it is that centering the United States in a way that often political science and politics research does, it leaves us kind of vulnerable to misunderstanding the panoply of ways that political organization can happen and the kind of variety of ways that transformational change can take place. And we're just focused on one, we're missing out on a whole world of options.
What could we learn from the country that has compulsory voting?
That's something else. So when I'm speaking about the kind of democracy project, many of the early interviews that I've had have been similarly frustrated participants in electoral politics. They'd rather not have a fee or fine for not voting, but that doesn't mean that the kind of investment, interest, and engagement is automatically up. And so I think regardless of one's of the kind of policy that drives how it is that people participate in the electoral process. I think that, again, like just being aware of the kind of political stakes that are going on is significant and important. And in Brazil, there's a multi-party system, which is quite different from the United States. And so whereas there are supposedly two, maybe three categories if you include independence. There's in Brazil, it's required that if you're interested in politics, to kind of look at the intricacies of each of the categories of political parties to see which platform one identifies with. But still, although there is this multi-party system, it kind of ends up falling into a few buckets of more popular political parties. So yeah, compulsory voting, I don't know if that solves the issue of voter apathy. I think, again, there are kind of systemic reasons why people will look outward to their own communities and own experiences and say, I'm not sure if voting really makes a difference if the kinds of ways that I am taxed versus those who have more resources, power, and authority are taxed, and I'm not seeing improvements in my own life. So yeah, that I don't know if compulsory voting is the way, because people just want to see transformational change, and they're starting to question, I think, especially when I see those who are responding to the questions that I offer. They're just like, I'm not even sure if I'm doing something that matters, even though I am compelled to do so because I don't want to fee.
Right. You mentioned some of the countries have quotas or percentages for representation. And that was a political decision in that country. Did that result in positive change?
Yes.
Or are they, you mentioned tokenism.
It's often, I think, it depends on how it is that change is assessed. So if the concern is numbers and representation, the numbers are up. The representation is higher, it is greater. Maybe I could go back to the slide on this, but yes. So when we look at parliamentary seats, so we're not talking about highest levels of office because we already know that that's pretty low. Women hold 36% of parliamentary seats, and 10 out of 19 Latin American countries have adopted some version of gender parity. The issue, as we see with Brazil, as we look here, it has a 30% quota. Which is nearing the kind of representation that we see broadly throughout the region. But because the enforcement of these kinds of laws and policies is weak, and as we see, there's open lists, parties have a bit more flexibility in the range of decision making that they can have. Brazil, which has a quota, ranks last in the region. So this has improved the kind of, again, representational politics that exists for women in the region. Has this improved the daily lives and conditions and experiences of women? When the most recently elected president of Mexico, and let me look back to my notes here. When she was recently assaulted publicly while speaking about women's issues, this is an example of how it is that representation has a limited reach when social constructs and social norms really have not changed much. And so that's to say, yes, there can be higher numbers. Claudia Scheinbaum. So she was recently assaulted in the street. But this is just to say that even her in her position as president of Mexico still faces, and with all of the resources and access that she has, still faces the kind of violence that any woman would face on the streets. So higher numbers, yes. Social transformative change,
Not yet.
that still remains to be seen.
Okay. How important are unions in Brazil?
Thank you for that question. Unions are important. Unions are significant. general strikes are not uncommon. They actually occur quite routinely when we talk about sectors like education, so teachers, professors, those who are working in public transit, seen that often in Sao Paulo. And so unions do have a strong role within the broader labor and political landscape of Brazil. The particular research that I have on domestic workers is fascinating in that the nature of domestic workers or labor, if you would make a comparison between like a factory job or something like that, organizing women who are working in individual households and have an atomized kind of labor group, it makes it challenging for union organizing in that way. And so the kind of union union facilities and the union organizing at a physical location is how it is that the women, and also word of mouth, where they're able to be drawn together. And so the kind of traditional ways that, as I mentioned, transportation workers who know each other, have routes, that sort of thing, it allows for a different kind of organizing to happen for teachers and instructors who work at a school. So this is, unions do have a strong presence in Brazil and do impact the communities that are there. But for domestic workers in particular, the kind of work that they do, the kind of labor that they have working in private households very often, organizing is a bit more challenging. And so the research that I do, I went to the physical space of labor unions to talk to the women who are domestic workers, who are in leadership, and who are, have invited others to gain information, to access information about their rights. And those spaces are absolutely necessary for the kind of organizing that domestic workers must do, given the nature of their labor.
Well, it looks like we've run out of questions and run out of time. We'd like to thank our speakers today. It's been very interesting. Jackie, any closing comments?
No, I would agree with you. Different kinds of research, but both very interesting.
Certainly expanded our view of the world and politics and how women are treated, as well as our understanding of the medical research related to cancer, which certainly is a big factor in our lives today.
Right, right.
So thank you everyone for attending today, and we hope you'll come back for another program and continue our fight for preserving women's rights, civil rights, and rallying for those rights when it's needed.